Hello, my name is Nick Pelto, and I've decided to do my informative speech on myasthenia gravis. What if your own body decided to sabotage your muscles, making them weaker the more you tried to use them? That's the reality of myasthenia gravis, which literally translates to grave muscle weakness. Myasthenia gravis is an autoimmune disease that causes neuromuscular symptoms and issues. It's a manageable yet serious chronic neuromuscular condition that causes muscles to become weak and tired, and is often called a snowflake disease due to its varied presentation and the symptoms that are associated with it. I was diagnosed with this disease 20 years ago, and I wanted to talk to you guys about what happens within the body when someone is affected with myasthenia gravis, what symptoms and diagnosis would look like for the disease, and what treatment options are available. So, when within the body, antibodies attack chemical receptors on different muscles throughout the body. This makes it harder for acetylcholine, which is a neurotransmitter, to bind to the receptors on the neuromuscular junction of muscles. Triggering of muscle contractions is weakened or does not happen at all. So here's a diagram of what the neuromuscular junction looks like. And as you can see in the blown up image, there's a small gap from where one end of a nerve comes down and where it would go to a muscle. So there's no direct contact between a nerve and a muscle. Between this little junction, those neurotransmitters are sent out and received. And when enough are received, that's what triggers a contraction for the muscle. So, because these receptors can be affected throughout the body, the disease can present itself in a variety of different ways. According to Johns Hopkins, some of the main issues involved issues with vision, which can be drooping eyelids or blurred or double vision. They can be issues where you're not contracting fully in your face. So what should be a smile might appear as a snarl or even crying. You're just not activating all the muscles that should be activating. You will also have issues with dysphagia and pronouncing words and slurred speech. So the muscles within your mouth can be affected as well. And then you can also have weakness in your neck or in your limbs. Symptoms from all these are from not enough of that neurotransmitter being absorbed by the muscle, reducing the muscle function itself. Sometimes the muscles that control breathing weaken to the point where a person needs a ventilator to breathe. This is called a myasthenic crisis and requires immediate emergency medical care. A myasthenic crisis may be triggered by infection, stress, surgery, or an adverse reaction. And I got that from the National Institute of Health. And so what happens is the diaphragm muscle that helps you breathe isn't getting enough of those neurotransmitters, and so it cannot contract to the point that it's helping to assist you with breathing. And the other thing making this disease very difficult to diagnose is a blood test can be used to help with diagnosis. About 85% of people with myasthenia gravis usually have high levels of the acetylcholine receptors antibody in their blood. So even though you may have this disease, you could be in the 15% that would be outside of what that blood test would cover. So now that we've seen how vast the symptoms can be for this disease, the treatment options are just as wide. So the first thing that is important to point out that according to the Myasthenia Gravis website, that there is no known cure for myasthenia gravis, but treatment options are improving, and there are several treatments that can help to keep the symptoms of the condition under control. Medicines are often used to help with this disease, and they are often used in a pair with one being an immunosuppressant and another being a inhibitor that allows the neurotransmitter to stay in that gap longer. So one medicine is going to take your immune system down to reduce the amount of attacks that those antibodies will have on cells. And then the inhibitor allows for a longer time for that chemical to be in the junction for it to absorb. Since there are fewer spots that the chemical can be absorbed, it helps if it can stay in that gap longer. A thymectomy can be a long-term option. That's where they go in and surgically remove the thymus gland. The thymus gland is where antibodies will go to learn between self and non-self cells within the body. And so the theory is that these antibodies are incorrectly learning. And so removing that gland will then allow for those cells to not be educated incorrectly. There are IV therapies that go along with the disease as well, but these are mainly just used as a short-term fix, usually to get someone healthy enough to have some sort of surgical procedure for this disease. The big one is plasmapheresis, where they will pull your blood out of your body, separate the plasma from the rest of the lymph fluid, and then in the machine, they'll spin that lymph fluid back together with synthetic plasma and then put that back into your body. Immunoglobulin therapy is also another option that helps reintroduce healthy antibodies into your system. Um, so there's also some newer therapies, according to the Mayo Clinic, that are targeting specific molecules within the cell. And even like most other things with this disease, not all treatment works for everyone. Where a study was done at Yale, and they found that with a lot of these newer drugs, that they're still only beneficial for 60 to 70% of the patients. So just keeping in theme, it's a true disease that has no one fix all solution. So from this speech, I hope all of you have a better understanding of what myasthenia gravis is, what happens in the body when someone is affected by it, what symptoms can be present with this disease, and all the different treatment options that can be possible to help someone with this disease. And so while myasthenia gravis is a lifelong condition, it is not a life-ending one. With early diagnosis and personalized treatments, the vast majority of people with myasthenia gravis can manage their symptoms to lead a full and active life. By understanding this snowflake disease, where no two cases are alike, we can better support those living with myasthenia gravis and promote continued advancements in care and diagnostics. Thank you. Just to get one more shot of all my audience members. Thank you.